And welcome back to our discussion on heart disease. Our experts in studio looking forward to taking your calls. I want to take a half a step back before we get into prevention, which is very important when it comes to heart disease at all. Signs, symptoms of a heart attack. I know that's life-threatening. Share a few, please.
Yeah, they're varied, but the classic signs are chest pressure, mid-sternal on the left side. Some people describe it as if someone's stepping on them, or just as heaviness. That pain tends to radiate over to the left arm, causing pain sometime into the shoulder or up to the left side of the neck. And classically, it's associated with some shortness of breath. Some people break out in sweats, and usually associated when they're doing some type of activity, improves with rest. So those are the classic signs. That being said, though, there is a varied presentation of a MI, pending MI. So many people present with these non-classic signs like abdominal pain or just a feeling of funniness.
And of course, this would be a 911 call or an emergency call at this point as we're being addressed. We're going to take a question from you. That's what it's all about. Hi, what's your question, caller?
Hello. My question is about the nutritional side of heart disease. I have a book that is written by a practicing medical doctor who states in his book that cell damage by free radicals has been scientifically established beyond a shadow of doubt that cell damage by free radicals is the root cause of more than 70 chronic degenerative diseases, including coronary artery disease, cancer, strokes. These are chronic diseases, arthritis, and they are prevented, he proposes, by taking supplementation of antioxidants, and he lists a whole number of antioxidants that he says fight these free radicals, and in his own practice has had amazing success. His name is Ray Strand, S-T-R-A-N-D, medical doctor.
All right. How do we respond to that, Dr. Miller?
Well, I think the caller's right. There is pretty good evidence that free radicals do cause damage to the lining of our arteries and in the vascular system. But I don't think there's any data to prove that taking any vitamins or antioxidants are going to really make a clinical difference. I mean, the caller is reading a book from somebody that has some personal accounts of some success, but that holds true for things like chelation therapy, where you may have an individual that had a success from that kind of a treatment, but there's nothing well documented in the medical literature to say that is something that should be done. And it's not endorsed by the American Heart Association.
Sure.
Although many of the antioxidants are suggested as part of being a balanced diet. So, if you get a good balanced diet, you are going to get those free radical fighting antioxidants.
Dr. Dulac?
Yeah, and I agree. I mean, I think this caller's looking at, or the author's looking at data that was generated. It's accurate. I mean, free radicals do cause significant tissue damage. However, to suggest that we take massive doses of vitamins, which I'm thinking this book generally, these type of books generally do propose, it hasn't been shown to make a change in outcome, because what we care about, we don't necessarily care about free radical damage. We care about dying from heart disease. Okay, there was a huge study that came out, in excess of 10,000 patients that looked at whether or not vitamins make a difference in America. Okay, it's because Americans generally have pretty good diets full of vitamins, and it didn't make a difference.
Interesting.
Yeah.
Another question from you. Hi, caller. What's your question, please? Hi, caller. We're ready for you.
Hi. Yes, you mentioned earlier. Hello.
Yes, please.
That stress and can cause heart attacks and heart disease. What are some of the things that you can do to lower your stress and anxiety?
Dr. Manhar.
Well, first, the second part that the caller asked, and I thank the caller for the question because not many people are willing to recognize that. But as far as anxiety, if you think that you have an anxiety disorder, please seek help, because help can actually lower your risk, and overall as well, it can make your quality of life better. As far as the stress that we all have, managing that stress is very important. And for some people, it might be as simple as going for a walk. Social interaction has been shown to decrease stress levels. Sometimes meditation as well. Meditation has been shown to decrease adrenaline levels in the body and lower blood pressure as well. So those are some ways out of many to decrease stress.
Can I add? I think that's excellent. Go for a walk, but don't walk toward the refrigerator. Maybe take a walk outside.
Yeah.
Because people often eat to combat stress too, and then again you have the issues with the blood sugar and the blood cholesterol
Sure.
levels.
Yep. Caller, a question from you, please. What's your question, please?
Yes, I wanted to know about, you talk about genes and heart disease, and what about families? My grandmother said, my great-grandmother had a heart attack when she was really old. And the other question I had was about aspirin, when you're talking about chemicals and vitamins. Should you take an aspirin?
Dr. Delap.
Yeah, I think aspirin certainly has been shown to help reduce the incidence of MIs. At 81 milligram baby aspirin is what's recommended. And the reason is because aspirin has an effect on the platelets. Doesn't let them stick together as well. So one of the problems when a person has a heart attack is that there's a clot, and that clot gets bigger and bigger because his platelets are sticking together. Aspirin helps prevent that.
Do discuss with your healthcare provider, though, because many of these studies have also made the caveats for particular categories of people, especially elderly, 80 and over. The risk of bleeding with the aspirin might outweigh the benefit, so do discuss that with your healthcare provider.
Very nice. What is the purpose of a stent when it comes to treatment?
Well, a stent is an alternate to the surgical treatment, which gold standard has always been bypass graft surgery. But if you've got a narrowing, what we would refer to as a stenosis in one of your arteries causing symptoms, there is an option sometimes for that to be improved from inside the vessel by going in with a deflated balloon, inflating the balloon to widen the area of the vessel and leave behind a stent, a coil, which looks much like a spring in a Bic pen, I guess. That'll stay inside the vessel, sort of acting like a scaffold to hold it open.
When you recommend your treatment post-MI at all, obviously you want to change the lifestyle. In other words, a stent doesn't mean you're cured. You want to continue your healing from this. Can you expand?
Oh, absolutely. I think risk modification is the most important thing as far as heart disease. The stent is simply going to fix you for the moment. You can reaccumulate a plaque if you don't stop smoking, if you don't change your diet, if you don't exercise. So the stent's just the beginning process of healing. You've got to continue.
All right. We have another caller. Question from you, caller. Hi, what's your question, please?
My question is angina. I heard that diabetic patients don't have pain in the chest, but a couple of times I had some sensations going up my neck when I was trying to walk. And what would you consider this angina, or what's the problem with that?
Sure. Please define angina, and take it from there, Dr. Miller.
Yeah, well, I mean, by definition, and I think Dr. Delap mentioned that typically angina is a discomfort in the mid-sternal area, perhaps radiating sort of toward the left upper extremity, but it can radiate up to the throat, up to the jaw. It's a little bit atypical, but that's still a very concerning sign. And then I think we're also going to make the point, and maybe you could fill us in on that, some people have next to no symptoms, which is obviously of a concern, and those do tend to be older people and sometimes people with diabetes or women as opposed to men.
Some of the less typical symptoms include nausea, feeling indigestion, lightheadedness, dizziness, sweats, passing out. So if you have symptoms that are not explained, you should see your healthcare provider and get evaluated for coronary disease. It is the most common disease in this country.